Modifier with detailed description. 22. Increased procedural services. Documentation is required when billing with this modifier. A short explanation of why this modifier was applied will also help expedite the processing of claims. 24. Unrelated E&M service by same physician during a postoperative period, used when a physician performs an E&M service during a postoperative period for reasons unrelated to the original procedure. 25. Significant, separately identifiable E&M service by the same physician on the same day of the procedure or other service, used by provider to indicate that on the same date of service, the provider performed two significant, separately identifiable services that are not unbundled. 26. Or PC, professional component. Certain procedures are a combination of a physician component and a technical component, and this modifier is used when the physician is providing only the interpretation portion. TC, technical component. Certain procedures are a combination of a provider component and a technical component, and this modifier is used when the provider is performing only the technical portion of a service. 32. Mandated services. Services related to mandated consultation and/or related services, e.g., third-party payer, governmental, legislative, or regulatory requirement, may be identified by adding modifier 32 to the basic procedure. 47. Anesthesia by surgeon. Regional or general anesthesia provided by a surgeon may be reported by adding this modifier to the surgical procedure. Amount allowed is 25% of the surgical procedure allowance. 82. Insurance health plans revised September 9, 2016. Replaces all prior versions. 62. Two surgeons MD, DMD, do. When two surgeons work together as primary surgeons performing distinct parts of a single procedure, each surgeon should add modifier 62 to the procedure code. The combined allowable for co-surgeons is 125% of the full procedure allowable. This amount will be split 50-50 between the two surgeons, unless otherwise indicated on the claim form. 63. Procedure performed on infants less than 4 kilograms. Documentation is required when billing with this modifier. A short explanation of why this modifier was applied will also help expedite the processing of claims. 66. Surgical team MD, do, PA, CRNFA, RN, SAW. When a team of surgeons, 2 or more, are required to perform a specific procedure, each surgeon bills the procedure with modifier 66. Fee allowance is increased to 120% of the basic fee allowance for the procedure. 76. Repeat procedure by same physician. This modifier is used to indicate that a repeat procedure on the same day was necessary, or a repeat procedure was necessary and it is not a duplicate bill for the original surgery or service. 77. Repeat procedure by another physician. This modifier is used to indicate that a procedure already performed by another physician is being repeated by a different physician. This sometimes occurs on the same date of service. 78. Return to the OR for a related procedure during the post-op period. Indicates that a surgical procedure was performed during the post-op period of the initial procedure, was related to the first procedure, and required use of the operating room. This modifier also applies to patients returned to the operating room after the initial procedure, for one or more additional procedures as a result of complications. Documentation is required when billing with this modifier. 79. Unrelated procedure or service by the same physician during the post-op period, indicates that an unrelated procedure was performed by the same physician during the post-op period of the original procedure. 80. Assistant surgeon MD, DMD, do. Only one first assistant may be reimbursed for a procedure code, except for open heart surgery, where 2 assistants are allowed. Payment will be allowed only if an assistant surgeon is allowed by our claims editing system. The fee allowance is automatically reduced to 20% of the surgical fee allowance is billed by the primary surgeon. Refer to Surgical Assistant Guidelines 11.5.3 of the Provider Manual. 50. Bilateral procedures. Bilateral surgeries are procedures performed on both sides of the body during the same operative session or on the same day. Unless otherwise identified, bilateral procedures should be identified with this modifier. A separate procedure code should be billed for each procedure, using modifier -50 on the second one. Refer to Bilateral Procedures 11.5.1 of the Provider Manual. 51. Multiple procedures. Procedures performed at the same operative session, which significantly increase time. Multiple procedures should be listed according to value. The primary procedure should be of the greatest value and should not have modifier -51 added. Subsequent procedures should be listed using modifier -51 in decreasing value. Refer to Bilateral Procedures 11.5.2 of the Provider Manual. 52. Reduced services. Allowed amount to be reduced to 80%, cut by 20%, then processed according to the contract benefits. 53. Discontinued procedure. Under certain circumstances, the physician may elect to terminate a surgical or diagnostic procedure. Allowed amount will be reduced to 75%, cut by 25%, then processed according to contract benefits. 54. Surgical care only. Used with surgery procedure codes with a global surgery period only. Fee allowance is reduced to 70% of the original allowed. See modifiers 55 and 56 below for additional details on pre- and post-op care only. 55. Postoperative management only. Reimbursement is limited to the post-op management services only. Used with the surgery procedure code, auto adjudication reduces fee allowance to 30% of the total allowed. 56. Preoperative management only. Reimbursement is limited to the pre-op management services only. Used with the surgery procedure code, auto adjudication reduces fee allowance to 10% of the total allowed. 57. Decision for surgery. This modifier identifies an E&M services that resulted in the initial decision for surgery and are not included in the global surgical package. 59. Distinct procedural service. Indicates that a procedure or service was distinct or independent from other services performed on the same day. Example: an E&M service for an ear infection and a surgical code billed for removal of a wart at the same visit. 81. Minimum Assistant Surgeon (CNM), CRNFA, NP, PA, RN, sought use this modifier when the services of a second or third assistant surgeon are required during a procedure. Use with surgical procedure codes only. The allowance is automatically reduced to 10% of the surgical fee allowances billed by the primary surgeon. 82. Assistant surgeon. This modifier is used when a qualified resident surgeon is not available. This is a rare occurrence. The fee allowance is automatically reduced to 20% of the surgical fee allowances billed by the primary surgeon. 90. Reference outside laboratory. This modifier is used when laboratory procedures are performed by a party other than the treating or reporting physician. Allowed should fall to contracted lab fees. 91. Repeat clinical diagnostic laboratory test. This modifier is used when a provider needs to obtain additional test results to administer or perform the same tests on the same day and same patient. It should not be used when the tests are rerun due to specimen or equipment error or malfunction. Nor should this code be used when basic procedure codes, such as Procedure 82951, indicate that a series of test results are to be obtained. 99. Multiple modifiers. Under certain circumstances, two or more modifiers may be necessary to completely describe a service. JW modifier is now billable for single-dose medications purchased for a specific patient when a portion must be discarded. SG, ambulatory surgery center. This modifier is used when the services billed were provided at an ambulatory surgery center, ASC. SU, procedure performed in physician's office, to denote use of facility and equipment. CMS has defined 4 new HCPCS modifiers to selectively identify subsets of distinct procedural services, -59 modifier, as follows, effective January 1, 2015. Z, separate encounter, a service that is distinct because it occurred during a separate encounter. XS, separate structure, a service that is distinct because it was performed on a separate organ structure. XP, separate practitioner, a service that is distinct because it was performed by a different practitioner. SHU, unusual non-overlapping service, the use of a service that is distinct because it does not overlap usual components of the main service. Your insurance provider service representative is available anytime you have a question or concern. Level 1 CPT modifiers -25, -27, -50, -52, -58, -59, -73, -74, -76, -77, -78, -79, -91. Level 2 HCPCS modifiers CA, E1, E2, E3, E4, FA, FB, FC, F1, F2, F3, F4, F5, F6, F7, F8, F9, GA, GG, GH, GY, GZ, LC, LD, LT, QL, QM, RC, RT, TA, T1, T2, T3, T4, T5, T6, T7, T8, T9. Therapy modifiers used to identify type of therapy service and level of functional impairment. Outpatient therapy code modifiers identify discipline of plan of care under which service is delivered. Modifier description GN services delivered under an outpatient speech-language pathology plan of care. GO services delivered under an outpatient occupational therapy plan of care. GP services delivered under an outpatient physical therapy plan of care. KX used to indicate the services rendered are medically necessary therapy. Functional modifiers used in conjunction with function-related G-series codes for physical therapy PT, occupation therapy OT, and speech-language pathology SLP, to indicate severity, complexity of beneficiaries. Percentage of functional impairment is determined by clinician furnishing therapy services. Modifier description CH 0% impaired, limited or restricted. C at least 1% but less than 20% impaired, limited or restricted. CJ at least 1% but less than 20% impaired, limited or restricted. CK at least 40% but less than 60% impaired, limited or restricted. CL at least 60% but less than 80% impaired, limited or restricted. CM at least 80% but less than 100% impaired, limited or restricted. CN 100% impaired, limited or restricted. Portable XRAY HCPCS modifier description UN2 patients served, used with procedure R0075. UP3 patients served, used with procedure R0075. UQ4 patients served, used with procedure R0075. UR5 patients served, used with procedure R0075. US6 or more patients served, used with procedure R0075. Position emission tomography PET scan HCPCS modifier description PI initial anti-tumor treatment strategy PS subsequent treatment strategy prosthetics HCPCS modifier description ELS FDA monitored intraocular lens implant.